I'm going to talk a little bit today about the need for data and the USDA perspective on that. And I think it will follow on very well with what Dr. Lewis just presented from the FDA. So this is the first slide, and basically that just introduces the topic. I'd like to give you a little bit of background on the national perspective on this issue, and it really starts with the global health security agenda and the World Health Assembly and the momentum that's been building among stakeholders in other countries, internationally and globally. And if you're not aware of all of that that's been going on, it's a big deal. There are 11 topics that have been translated into action items for the global health security agenda as it relates to the World Health Assembly, and 3 of them have been placed at the top of that list by our own USA in-country executives that are primarily Department of Defense, Department of State, Health and Human Services, USDA, and so forth. Bioterrorism is one of them. Biosecurity is the second one, and at the top of the list, believe it or not, is antimicrobial resistance. And what the Global Health Security Agenda calls for is for each country that's part of the World Health Assembly to develop a national action plan as it relates to combating antimicrobial resistance, or antibiotic-resistant bacteria, as is what the CARB acronym stands for. So back in September of 2014, there were some things that happened all at once. Once the President's Council of Advisors on Science and Technology Policy, and the PCAST, if you will, and then the executive order that was issued by President Obama about the PCAST report and the national strategy all came out at the same time, September 18th of 2014. Now, that executive order calls for the development of a national action plan. And that's the national action plan that fits into the Global Health Security Agenda. That national action plan has been forwarded to the President's desk. The executive order called for that to be delivered on February 15th of this year. The USDA worked very hard to inject its items into that national action plan to make sure that they were there. And you can expect that in the next month or two, that national action plan will be unveiled. And what Dr. Lewis was talking about in terms of pulling stakeholders together and taking a look at what the data needs are and what they are from an agriculture perspective, that meeting will come probably right on the heels of the White House exposing to everybody what the National Action Plan is. So today I want to talk a little bit about the USDA roles as it relates to what is occurring at the FDA, the changes that have been made there, and then dig down a little bit deeper into APHIS Veterinary Services roles. So the agriculture interest, if you will, in engaging stakeholders on this topic really took place back in May of 2012. And there was an USDA antibiotic workshop that took place in Beltsville, Maryland, that was co-sponsored by FDA and USDA, USDA being primarily the Agriculture Research Service and APHIS. And in that meeting, there were several things that came about that emerged from the discussion there. And you've got the website that you can go to pull that report. If you haven't read it, it's a very interesting report. We brought stakeholders together from public health, consumer sectors, and agriculture sectors. And what emerged from there was that we need to examine the trends in terms of antibiotic usage and also to take a look at resistant organisms, particularly in agriculture settings where antibiotics might be used. That we need to take a look at alternative interventions and strategies, things that don't lead to the emergence of resistance in bacteria. We need to understand how management practices on the farm affect the emergence of resistant bacteria, whether antibiotics are used or not, and which ones are being used on the farms. And then we need to be conscious of the fact that the policy impacts and the economics really are important, whether we stop using antibiotics or not. How does that going to affect the ability to produce food in this country? Because it really is a national security concern, and that's part of why it's on the global health security agenda worldwide in terms of the interest from the World Health Assembly. The outreach and education is also important, and that's one of the measures that we're under pressure collectively as U.S. government to measure, particularly as it relates to that agenda, because part of the third world country impact on emergence of resistance is the readily available antibiotics that are available for use in third world countries for both people and animals. And one of the things that is really important is the whole notion of surveillance, but also the idea that there would be enough outreach and education to convince people that they'd ought to be careful in using these tools that they have available, both in human medicine and in agriculture. So stewardship becomes important. If you look at that report, the agriculture stakeholders themselves, these are the kinds of things that emerged from the discussions, in particular that antibiotic sales is a poor indicator of use across modalities, across species. Dr. Lewis mentioned that in the future we're going to be looking at, FDA is going to be looking at more of the sales indicator information in terms of what the label indication is, but also what the antibiotic is being used for on the farm in terms of which species it's going into. Is it poultry? Is it beef? Is it swine? And that we need science to inform policy decisions, and that's going to come from doing surveillance, doing research, and educating people about stewardship. And the terms like judicious use, medically important, evidence-based, in order for us to understand what they mean, we need good data to back them up, and we also need to do outreach and education to educate people, in particular veterinarians that are going to write the veterinary feed directive, what these terms mean in reference to the actions that FDA has taken already with their guidance 213. There was pretty much agreement from the ag sectors that that should be data driven, and that there should be risk assessments done based upon that data that would inform policy, both at the USDA and at the FDA. And there was agreement amongst the agriculture sectors that the research activities in USDA ought to be separate from any regulatory activities. And really, by the way, I would like to emphasize that all of the activities that I'll talk about in terms of what we're doing at APHIS are non-regulatory. They're heavily dependent on the voluntary participation of industry. Now, the non-agriculture stakeholders, it was interesting because these are the public health sectors, the consumer sectors. They believe that, in large part, the health risk is best addressed, at least at that time in 2012, by decreasing the overall use of antibiotics, the amount of antibiotic. And that's really where the data that we have available to us now gets us a little bit in trouble, because when we look at the predominant use of antibiotics by weight of active ingredient, most of that, and you've all heard the figure, 80%, I don't know that's entirely accurate, but you've heard that figure, and it's in the media, and that figure sticks in people's minds. So they automatically go to a place where if you believe that 80% of antibiotics are used in agriculture, then 80% of the problem comes from agriculture. And that's something we really have to be careful with explaining completely, and part of the reason why we need to collect better data about antibiotic use in agriculture. Now, those sectors also advocated better hygiene and management. There's this whole notion of intensive agriculture and the relationship that intensive agriculture has with insanitary conditions. And the general public isn't educated enough about how we raise animals in agriculture to know that all of these technologies that I have listed here, especially all-in-all management of facilities with cleaning and disinfection between animal fills, if you will, that the efforts that we make is what causes the health of the animals to be better than it would be otherwise, and why intensive agriculture can emerge from more traditional agriculture practices in the first place. So what the human health sector really needs to understand is how we in agriculture use these technologies, and we do that in order to provide better health conditions for animals, and that because of that they grow better. And what we're seeing is that where those economies of scale in the past helped us to grow as an industry more in a direction of caring for the animals, the market dynamics that are being used by the consumer and the public health sector really further different types of agenda, everything from animal welfare to vegetarian diets, and you heard some of that in the presentations this morning. So we have to be careful and ensure that people know that the work that we're doing in agriculture is important to animal health, and it's because we raise healthy animals that we have healthy people. So why do we need data? I tell this story, I've told it at the National Chicken Council and at the NCBA, so those of you that were here or there have heard it before, but every year I find dead birds on my deck outside my picture window, and the reason why they're there is because they exercise their territorial imperative, and when spring comes, the male birds fight with each other for that territory where they can establish their brood, and they see the threatening behavior as a reflection in the window, and they dive at the window over and over again until eventually they break their neck, and then I find them laying dead outside the picture window. And what I tell people is, those birds are not stupid. They just don't have all the data. And we can make bad decisions if we just don't have all the data. We have to have all the data. Well, why don't we? It's primarily because as we talk about this, the fear is that something will be done to us. So on that cartoon off to the side, it says, before I write my name on the board, I'll need to know how you're planning to use that data. Well, that's one of the biggest industry concerns that I hear consistently all the time when I talk to stakeholders. Yes, we'll provide the data to you. What are you going to do with it? How are you going to analyze it? What conclusions will you draw? Is that going to be good for us, or is that going to be bad for us? Well, I don't know. I don't know, and I don't think that we together collectively know very much about this very complex issue. We're going to have to learn together what data is important for us to have. One thing I do know is that it doesn't do much good if we don't have all the data that's available to us and make good policy decisions based on that. The important thing about the Veterinary Feed Directive at the top of this list here is that that feed directive is not designed to limit the appropriate use of antibiotics. The appropriate use of antibiotics is what that Veterinary Feed Directive is supposed to accomplish. And we need to decide which bugs and drugs are important to us that we need to be monitoring for emergence of resistant pathogens. Dr. Lubbers talked a little bit about the fact that they do sensitivity testing in the laboratories routinely, veterinary diagnostic laboratories routinely. We need to standardize some of that testing in a way that we can share data across diagnostic laboratories and for the purposes of the surveillance that we're talking about with NOMS, and be able to analyze that data in a way then that's consistent and according to scientific methodologies that are accepted by the scientific community. Right now, use data is all we have, and the observational data that we can collect through the NOMS system of monitoring and through the National Animal Health Laboratory Network, and the observational data that's coupled with the information that comes from the diagnostic laboratory when resistant organisms are isolated, that's the only way that we can assess the risk associated with those types of resistant organisms being found and whether or not they were exposed to a particular type of antibiotic for a particular time period before the testing was done. So I stole these bottom 2 points from a presentation that Dr. Lubbers, I think, was the one that did in Kansas. And here's the risk with use data. Because if 30% of the 80% that people talk about with antibiotics sold to agriculture is ionophores, then that's a lot, 30% of the 80%. And ionophores are not medically important antibiotics. In fact, there's no use of ionophores in human medicine. And in addition to that, there's very, very limited indications that any resistance occurs as a result of use of ionophores in agriculture. So in terms of what we think about for research and what we're trying to accomplish, maybe the ionophores are the standard we ought to be shooting for. There's no use in human medicine, there's no resistance that comes about as a result of the use of them, and yet they are antibiotics and they're counted within that 80%. So if that's true, and 30% of the 80% is ionophores, and if 15% of the 80% is growth promotion indications being used for growth promotion indications, and if therapeutic use actually does increase as a result of the withdrawal of that growth promotion use of antibiotics, then the likelihood is that when we measure just use, and we've measured it over a period of time, if the veterinary feed directive goes into effect in December of 2016, after that, we may see little to no change. And so the conclusion will be that the Veterinary Feed Directive Guidance 213 was not very good. It didn't work. It didn't accomplish what the public health and the consumer sector said needed to happen in order for resistance as part of the agriculture problem, the resistance problem that agriculture contributes to. It didn't make any of that go away because the actual amount of antibiotic that's used probably isn't going to change very much. So right now the Food and Drug Administration does collect amounts of antibiotics sold from pharmaceutical companies. They make that information available. As Dr. Lewis said, there's no information yet on the species that's used, no information on exact amounts used in terms of dosage per pound or within a production sector. And there's no information really on indications for use other than what's on the label, and that's the only way after 2016 that those drugs ought to be used, is according to the label. What USDA is proposing to do is obtain and disseminate science-based, actionable, quantitative antibiotic drug use information coupled with information about the development of resistance in food-producing animals and relate this back to livestock management practices on the farm. That comes directly from the USDA's action plan that you can find on the APHIS website. And to re-emphasize, as we go about collecting this information voluntarily through NOM surveys on the farm and from the National Animal Health Laboratory Network, FDA is going to rely on this information to inform its policy and regulatory decisions. So they're tapping into our extensive network of collaborative relationships, both for outreach and for data collection on the farm, with producers and with veterinarians. And I might mention that another measure that I think we need to be careful or conscious of is the fact that we're being asked questions about how effective the outreach is to veterinarians, to educate veterinarians about what judicious use is, what medically important antibiotics are, what antibiotic stewardship means. And our National Veterinary Accreditation Program is a really good way for us to reach out to practicing veterinarians in the field. We already have a judicious use module as part of the training for the Veterinary Accreditation Program, and we're looking at expanding that to be able to acquaint veterinarians in private practice more completely with the Veterinary Feed Directive and their responsibilities under that, and perhaps even provide them with an opportunity to understand how to fill out a Veterinary Feed Directive properly. So here's what needs to come about as a result of all this data collection, and good public policy really depends upon access to complete and correct information. We do need to be able to explain the scientific methodology of analysis, and we need to be able to communicate the risks associated with antibiotic use in agriculture settings. In order to be able to communicate that, we need to understand it. And lastly, we need the ability and the courage to challenge the assumptions, because I think most of us in agriculture would agree that the human health and consumer sectors are basing an awful lot of what they believe on assumptions, that there's a direct line relationship between the use of antibiotics and the idea that there's emergent resistant organisms that threaten human health. I read an interesting book not long ago written by Daniel Kahneman, and in that book he talks about WYSIATI. And you've all seen the WYSIWYG acronym, you know, what you see is what you get. But what he says is that with this, what you see is all there is. So in other words, if the broad general public only sees use data and they draw conclusions from that and that straight line relationship with the emergence of resistance and the threat to human health, because there isn't anything else, then it must be true. And that's what produces the mass consciousness. That's why we need to collect data, and it's why we need to be able to convey to the public what it is that we're doing and why it's effective, and whether or not there really is a risk to human health as a result of the use of antibiotics in animals. The whole idea of therapeutic use and production use, Dr. Lewis talked about that, production use being the growth, promotion, and indications on the label, and the therapeutic use being control, treatment and prevention. That therapeutic use is being challenged, and the prevention part of that in particular is something of concern, I think, to agriculture. And the point's being made over and over again that the use for prevention, the dosages are not very much different, or they may even overlap, but at least they're one stacked on top of the other. And how will we know that producers don't take feed that's been medicated at 100 grams per ton and mix it with another ton of feed that doesn't have any medication in it, and then feed it at 50 grams per ton, which is the growth promotion dope. So there's going to have to be down the road at least some way of being able to communicate to the public that doesn't happen, and probably the primary reason why it won't happen is because it costs money, and because it's under the control of veterinarians that write the veterinary and feed directives. So judicious use, this is another reason why we need the data, because if you read about judicious use and preventative use is looked at in FDA Guidance 213, these are the things that veterinarians need to consider before they write that veterinary feed directive for preventative use. First, there has to be evidence that it's effective, that it's consistent with accepted veterinary practice, that the use is linked to a specific etiologic agent that you're trying to prevent, and that use is appropriately targeted to animals at risk of developing that particular disease, and that there are no reasonable alternatives for use of a medically important antibiotic. All five of those things are dependent upon the veterinarian and private practice having enough information to make those decisions and make them in an intelligent way. Well, where are they going to get that information? The only way that we can do that is if we monitor the effective use of antibiotics and provide that information back to veterinarians. And if veterinarians know that as they write the veterinary feed directive, what it is they're targeting, why they're doing this for preventative use, and that they're doing it at the right time against the right bug in the right dose to make it effective in prevention. So that's a part of why we need to collect this information. So the USDA roles: surveillance, research and development, education, extension and outreach, and developing the metrics to gauge progress. Along the side there with the logos, I've got the emphasis within USDA for each of these things. So surveillance, the monitoring that we're doing in the NOMS unit, the risk assessments and so forth, that's primarily us and APHIS. Research and development, ARS and NIFA, are both the research arms within USDA. One is intramural, being ARS, the other is extramural, funding for research to occur in academic institutions and so forth. And education and outreach certainly is NIFA, the old cooperative extension group that is now NIFA. And certainly we have a role in that as well. But in terms of emphasis, as ARS does have a role with surveillance, but in terms of emphasis, we see them lining up this way. Now, the metrics to gauge the progress, the Economic Research Service, NAS statistics, and the Foreign Ag Service looking more globally, as we collect data there, it's going to be interesting to see, because ARS and NAS, or ERS and NAS, are the ones that administer the AMS program, and as farmers, most of you are familiar with what that is. So I'll talk about them each a little bit in order. Here's the NOMS, the monitoring and surveillance, collecting information about antimicrobial use, and coupling that with the collection of biological samples on the farm at the same time is important, and being able to get that testing for the biological samples done in the laboratory system consistently across the board, state to state, and sector to sector in terms of the agriculture sectors being monitored is going to be important as well in order to analyze that data. Taking a look at the EPI relationships, those relationships between the farm management, the use of antibiotics, and the on-farm resistance that emerges, the patterns that emerge there. The best information that we can provide back relies upon that systematic capture of diagnostic specimens and all of the information related to the time in which those specimens were collected and the background of management and antibiotic use. So the NOM system is used to doing commodity studies. They have developed questionnaires over the year. I might emphasize that NOMS is a statistical unit recognized under CIPSE, which is the Confidential Information Protection and Statistical Efficiencies Act, CIPSE. And because of the fact that we would be collecting this information voluntarily under CIPSE as part of a survey, we're not subject to FOIA. So we actually cannot, not only that we would not, but we cannot, without severe criminal penalties, provide that information to anybody that asks. We're prohibited from doing that. So we have the confidentiality part of the survey questions being collected covered. What we intend to do with NOMS is do ongoing longitudinal studies with voluntary participants each year, year to year, time to time, not just once every 3 to 5 years with somebody different to represent the commodity groups, but ongoing longitudinal studies and collect more detailed data and biological samples. And what that will do is it will help us to parameterize these predictive models that you heard talked about earlier today with the water and the satellites, in order to be able to then show how different factors that result in the emergence of resistance have a bearing on what we see at the end of the day. And those types of models right now do not exist. So here's the agriculture research program, areas of research that we're doing in ARS. And one of the most important things is to characterize the intestinal biome of some of the major agriculture species, because what will happen then is, as that's characterized and as antibiotics are fed, we can see what the changes are within that biome and why they occur and what that means in terms of the human health risk down the road and what we might see emerging as resistance patterns on a farm where there's a population of animals that would be exposed to antibiotics as well. So that's going to be an important part of what we do. Here's the ARMS survey, the Agriculture Resource Management Survey, and this, as I mentioned, is something that's done. It was focused primarily on economics, still is. It's where all of the data comes from that is used across the U.S. With market predictions and volume predictions in terms of agriculture production itself. But what we're intending to do is take a look at those market level impacts and at the same time collect more use data related to antibiotic uses on these farms with the use of these survey tools. And that will be part of the overall enhancement with NAS and ARMS. National estimates of antibiotic drug use can come from here. More specifically, those estimates can come from what we gather in terms of NARMS data on individual farms with those longitudinal studies. But we'll be looking at, in these particular instances, the effect on farm productivity, the costs, the production practices themselves, track the adoption of those production practices, be able to see when there are trends that emerge over long periods of time that make a difference. And we'll be able to feed that information back to the FDA and provide that information to them so that they can put meaningful policy in place pursuant to their guidances that are already published. And not the least of which is important, that bottom bullet there, but identifying critical areas for more focused collaborative research and education and outreach efforts. And that's really going to be important as we go along, because all of this data gathering, analysis, and so forth means nothing unless we can provide information back to the industry. Now, we heard Craig talked about NARMS, and that's the FSIS participation from USDA. You see their logo up there in the corner. Collecting biological samples at slaughter and being able to test those isolates to monitor drug susceptibility. And what we're suggesting is, as we do that, and we've been doing this for quite some time now, that the resistance status and the array of microbes in the slaughter plant could really then be evaluated in terms of the contemporary on-farm practices. As those practices change over time, as antibiotics are withdrawn for growth promotion, as more therapeutic use is observed in animal populations and animal sectors, what does that mean in terms of how many microbes are isolated at slaughter that are resistant, and whether or not that represents a risk to human health? And maybe what we're going to see is that that will decrease over time. One thing that I did emphasize already, but I'll emphasize it again, all of these activities that I talked about, all of them except what FSIS is doing in the slaughter plant, which is a regulatory program, all of them are voluntary. We really need the help of industry to cooperate with us to be able to do anything related to what we're suggesting we're going to do in this national plan. Some of the challenges that we face is being able to get that support. Being able to get that support from the AASV, from the National Pork Board, from the NPPC, from AAAP for the poultry, for the National Chicken Council, from the turkey growers, from beef cattle, and the NCBA and the AABP, and all of these groups need to be participating, as well as private practitioners that are accredited and licensed in a state. And we really need that, because if we don't have it, none of this is going to happen and none of it will be successful. Now, in terms of the coordination of the various action plans, the cooperation between FDA and USDA, for instance, that's progressing very smoothly. I think that the working relationship that we've built with FDA is fantastic. We're doing a very good job of coordinating across the board for the national action plan between USDA, agriculture interests, FDA, as well as CDC. And even though the bulk and majority of the millions of dollars that are going to be spent on this program, overall program, are going into the human health sector, there is interest in making sure that we have what we need to be able to complete this, to be able to accomplish this. And you know, we're going to face challenges as we go forward and build upon it, being able to get adequate funding to be able to continue to gather the kind of information that we need to characterize antibiotic use in agriculture and the emergence of resistance. Some of the other challenges that we face are more minor along the way. Regulatory process in the U.S. as far as the Paperwork Reduction Act and so forth, to be able to complete these surveys take a long period of time, as many as 9 to 12 months sometimes, to be able to just put a survey out to agriculture. But we think that because of some changes that we've made in terms of our relationship with OMB, with the Office of the Management Budget, and because of the attention that this issue is getting, if we can get the funding that we asked for in 2016, it's in the President's budget, $10 million is there for us to do this, to get started at least, that we can probably get that started much sooner than that we won't have that long waiting period to be able to do this survey. And then to emphasize that last point, we've developed an action plan within USDA. There's a national action plan on the desk of the President now that you'll see within a few months, I hope, and that we're very conscious of the fact that as we develop this, we can't get on the wrong road. We can't start out the wrong way. We have to do this in concert with you all, with industry. We need to know what's important to know. We need to be able to communicate to you how we're going to analyze that data and what sorts of policies might emerge from it, so that agriculture as a whole is comfortable with what we're doing and how we can help change the public perception.